Assalamualaikum and hi everyone. My name is Nor El Aini binti Rohaizan from SR134B.
Hi, Assalamualaikum. My name is Putra Ainin Sofia binti Saleh from SR134B.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Najiha binti Roslan from kelas SR134B.
Hello and Assalamualaikum warahmatullahi wabarakatuh. My name is Karodana Adam bin Kar Azma and I am from SR134B.
Hi, Assalamualaikum. My name is Ismul Lokman bin Jamali.
Today, me and my groupmates will be presenting the SOAP notes for shoulder injuries. But first, let me introduce to you guys our athlete. Muhammad Sharul Naim bin Rashid was born on the 24th of December 2002 at Hospital Selayang. He represented Selangor in rugby. He started to get involved with rugby when he entered high school. He played as a hooker for his school team. If you do not know what is the function of hooker, a hooker has a great deal of contact with the ball. They also play the role of halfback or dummy half. At first, he joined his school rugby team as a way for him to fill up his leisure time and get some exercise. But later on, his interest in rugby started to grow. He helped his school to win numerous tournaments and games. In 2018, he helped his school to win second place in the Asia Sports School Federation Under 18. His performance was recognized during the tournament. His name was called up for selection and training phase 1 with the Under 18 Malaysian rugby team. But during the Asia Under 18 2019 game, Muhammad Sharul Naim suffered a shoulder injury. He suffered a dislocation on his left shoulder caused by a hard tackle from his opponent. He fell down and dislocated his shoulder.
In this video, I'm going to talk about the introduction of shoulder injury. In past few years, the frequency of shoulder injury among rugby players has increased. It is because of the game become more aggressive and fierce throughout the time. Moreover, the shoulder region will get a big impact and leverage pressure during the tackling, scrums, rucks, and also maul phases. Shoulder joint has been the most flexible joint in the body and can turn in many directions. It is one of the most important part in our body where various activity that we can do with our shoulder joint, such as throwing a ball, catching a ball, and also our daily routine activity such as lifting heavy things and also picking up our groceries. However, because of the flexibility of the joint, it become unstable and also prone to injury. There are few common types of shoulder injury, but young people and also athletes are more prone to dislocation. For the athlete, certain motion performed such as tackling and also throwing a ball might cause instability in the shoulder joint. It can produce discomfort gradually or suddenly, and it can produce discomfort suddenly or gradually, and also might lose feeling in the arm and arm weakness. Rest, physical therapy, and also surgery is one of the treatment that can be done if the athlete involved in shoulder injuries.
The shoulder is a synovial joint composed of three bones, which is the humerus, scapula, and clavicle. Our athlete Muhammad Sharul Naim suffers a dislocation on his left side of the shoulder. A dislocated shoulder occurs when the head of the upper arm bone, the humerus, is either partially or completely out of its socket, the glenoid. Whether it is a partial dislocation or the shoulder is completely dislocated, the result can be pain and unsteadiness in the shoulder. It is a typical type of shoulder dislocation when the shoulder moves forward, or anterior instability, meaning that the head has been pushed forward of the joint. Shoulder dislocation can happen to anyone, but are more common to young men that play sports or elderly. In our case, it is a young athlete that is playing contact sport like rugby. Shoulder dislocation can cause significant pain. This is because when the humerus is forcibly pulled out of the socket, muscle, cartilage, and also other tissues are stretched and torn. The muscles that surround the shoulder joint often contract, making even the smallest movement painful. The humerus head has been displaced out of its regular spot in the glenoid fossa.
So now I'm going to present about the subjective of in the SOAP note of the presentation. Okay. When suffer shoulder dislocation, Shahrul Naim cannot able to lift heavy stuff. It will give pain to his injured shoulder. This injury has a negative impact on him, such as sadness, frustrated because he cannot participate in sport before the injury recovers, and also lack of confidence. The sides of the injury suffered by Shahrul Naim on the left side of his shoulder. When this injury occurs, he decides to see a doctor, and the doctor suggests to perform the surgery on the injured shoulder. The surgery that is suitable for the injury that he needs to do is called arthroscopic shoulder surgery. The symptom that he suffered during the injury is he cannot move the hands because of the pain and numb at the shoulder area. He feels sharp. He feels sharp around the pain area. After a minute, the pain spread into other area that made him feeling and want to faint. The patient described the pain by scale to 6/10.
Next is the causes of injury. Shoulder dislocation can occur in anterior or posterior position. Individuals also may show the sign of instability of the shoulder in either one direction. In this case, the athlete involved in the tackling movement accident where he resulted in anterior dislocation shoulder. Anterior shoulder dislocation is frequently caused by the impact to the abducted, externally rotated, and also extended arm. The glenohumeral joint is particularly prone to dislocation in the 90-degree abduction and also 90-degree external rotation positions. It is due to the lack of ligamentous support and dynamic stabilization. Rotator cuff injuries are possible in any extreme situation.
Next slide, I will present about the signs and symptoms of shoulder dislocation that this athlete experienced. Firstly is numbness. Numbness describes a loss of sensation or feeling in a part of your body. It's often accompanied by or combined with other changes in sensation such as pins and needles feelings or burning. Next is he was unable to move his arm, and then muscle spasm happened. And yes, it's normal for a dislocated shoulder to cause muscle spasm. This uncontrollable movement can worsen the pain. Muscle spasm is a sudden involuntary movement in one or more muscles. People may also call it a muscle cramp or twitch. Lastly, swelling and bruising of your shoulder of your upper arm.
Now, the objective of the injury is to identify the specific injury and choose the convenient test to the patient. When someone silent injury on their shoulder, you can identify the injury by doing the range of motion test. In this case, we can test the patient by perform and place scratch test. In this test, the patient attempt to touch the upper side scapula to test the range of motion of the shoulder. By testing abduction and external rotation for left shoulder and testing adduction and internal rotation in the right shoulder. Next, we can identify using mid-range of motion muscle testing in strength test category by perform shoulder flexion test. Patient will flex the shoulder to 90 degree and trainer will look on the injury grade based on the patient pain. The last one is a special test which is passive range of motion test. In this test, the patient should be in a relaxed position and the trainer will help the patient to move the injury part until point of pain. The test that recommended for passive range of motion test for athlete with shoulder injury is supraspinatus examination. The patient attempts to elevate the arms against resistance while the elbows are extended. The arms are adduction and the thumbs are pointing downward. For the next presentation, I will pass to Ismo Lukman.
Thank you, Najha. Now, I will explain about the assessment and the treatment plan for the athlete. Based on the result, the subjective and objective evaluation of the athlete, Muhammad Shahrul Naim has been diagnosed with a dislocation in his left shoulder. This is because he felt pain after having a collision during a rugby match. He felt numb and movement in his left shoulder was limited and could not move his arm. The pain made him feel less comfortable to lift things and do an activity. The intense spike of pain was felt by him after the match. The pain scale is on a scale of 6, which is severe. For additional information, X-ray and MRI can be done to identify more about his injury. Next is plan. He will go through with a rehabilitation and guidance exercise to improve and help fight the pain. This plan will run for 12 weeks based on his current condition. Treatment plan goes for him is he can move his arm with little pain but can relieve that pain with ice and medicine in short-term plan. This term will take in 3 to 4 weeks based on the progression indicated by him. For long-term plan, which is he can back to the sport with strength without having a trauma about the injuries. Based on his confidence and eagerness shown by him, this plan can be achieved in 2 to 3 months. Next, I will pass to Elaine to continue about exercise for the athletes.
Okay, next I will present about the exercise that need to be done for shoulder dislocation treatment. Firstly is strength. There are two types of strength exercises which are static and exercise that using TheraBand. For static strengthening exercise, the athlete can do shoulder flexors, shoulder extensors, shoulder abductors, external rotators, and internal rotators. Static shoulder exercise work the muscles in the shoulder without moving the shoulder itself. For these exercises, your elbow should be bent to a right angle and your arm should not be moved. Okay, for shoulder strengthening exercises that using a TheraBand, you will need to attach the TheraBand to a stable point at the waist height. Okay, if possible, hold each exercise for 3 to 5 seconds, then let your arm return slowly. By using TheraBand, the athlete can do external rotators, internal rotators, shoulder extensors, shoulder flexors, and shoulder abductors. Okay, second is we are focusing on your flexibility. The athlete can do scapular setting exercise like lower trapezius in prone lying, lower trapezius in standing, serratus anterior in supine lying, and serratus anterior in 4-point kneeling in order for the shoulder to return to abnormal movement, strength, and function. It is important that the shoulder blade is aligned and supported sufficiently. Okay, lastly is cardio. We will do the weight bearing. Okay, the athlete can practice the push-ups against the wall and push-ups in 4-point kneeling. Okay, next slide. I will present about the do's and don'ts for your shoulder dislocation injury. So, for what we should do are stop if it hurts because it may worsen the dislocation area. Okay, furthermore, aim for balance because you need to stabilize the rotator cuff. Next, be careful with rolls, pull-ups and raises because athletes might suffer a second dislocation. Any force that pulls the arm away from the shoulder should be avoided. It creates too much risk on a shoulder that is already unstable. So next, be careful with your lower body too. Even heavy deadlift can put undue stress on a weak shoulder joint, even though the lower body does the bulk of the lift. So you should also avoid back or front loaded squats while your shoulder is healing. Then don't do exercise that can stress your shoulder, and don't quit physical therapy too early because it is important to keep the muscle balance and help the rotator cuff and improve your overall shoulder strength. So that is all from me. Thank you. I pass the next slide to my friend.
Okay, for rehab program, this program will run for every 3 days of the week. This program is going on month by month, increasingly slowly. The intensity of the athletes schedule will start in a light to moderate manner in 4 weeks and will then be moderate in 4 weeks. Slowly increase the time will take for athlete to do activities without pressure. The injured area will be included from the early stage to the result of mobilization. The rehabilitation program will slowly enhance the stage of rehabilitation that started with the initial stage. After the entire stage, he can return to the sport by recovering the muscle flexibility and function necessary to make sport easier again. This rehab program monitors pain, heat, softening, roughness from time to time at place where the injury is done, range of motion or movement, and ability to perform and function. There are 3 phases that have in this program. In the first phase of program rehabilitation, in this exercise is stiffness and pain in shoulder, which will help athlete shoulder to recover. The main focus of the second phase is to increase range of motion further, increase muscle strength, especially as its rotator cuff, and to re-establish the muscle balance in athlete shoulder. The progress will depend on the nature and severity of the athlete's injury. The aim of third phase is to make progress towards functional and sporting activities by helping athletes to regain the neuromuscular control of the shoulder. This is achieved by exercising the unstable shoulder in position that challenge the shoulder muscle fully. That's all from me. Thank you.
SOAP notes are a highly structured format for documenting the progress of a patient during treatment and is only one of many possible formats that could be used by a health professional. They are entered in the patient medical record by healthcare professionals to communicate information to other providers of care, to provide evidence of patient contact, and to inform the clinical reasoning process. The SOAP notes has 4 components which are subjective, objective, assessments, and plan. All of these 4 components play an important role.